At DFI, we really celebrate Denver's diverse community, and we offer services that are catered to meet the specific needs of people from all backgrounds, all cultures, all religions, all sexual and gender orientations. And we take great pride in the safe space that we create for people from all walks of life.
The part that I love the most about DFI is the quality of people who are part of the community. From the director and the staff, to the faculty, to the people who have their offices here, to the students, they're all just these great, heartfelt people that are a joy to be around and who really have a passion for helping strengthen families.
I believe so much in the mission here at Denver Family Institute, and serving families, serving couples, helping families have a richer life together, a more harmonious, peaceful, happy, loving family relationship, and everybody lives that mission.
For me, this is about being part of something bigger than myself and giving back to the community.
It's a labor of love for all of them. Nobody's getting rich teaching at DFI. And they do it because they believe in it, and they're really committed to helping develop therapists, and this idea of spreading this kind of word throughout the community of sending out family therapists.
I mean, we're helping keep a community together by keeping families together and supporting families.
Our therapists are extraordinarily highly trained. They have a specialized education in conducting couples and family work. The average degree program, you can get your master's degree without taking one class in family intervention. Our students take 13.
You're getting really, really high-end, incredible counseling from trained, dedicated professionals.
I think the training is so phenomenal that it brings that systemic lens into different nonprofits and organizations throughout the community, but it's also an amazing resource for clients.
I think that the combination of the fact that it is a clinic for the Denver community, but also that it's a training program, is actually probably the coolest part.
Having, again, a clinic with quality people, quality service, supervised, professional, for an affordable fee, taking on just about any case that walks in the door, is really unheard of.
We don't diagnose here, which is helpful because you're not putting a label on someone, you're helping them with what they need and where they're at, because I just believe that someone doesn't necessarily have to fit all of the criteria for clinical depression to be struggling with depression.
I think that DFI has a great impact on the Denver community. We really are kind of a safety net for people who don't qualify for some of the public assistance.
We have a sliding scale fee here, which makes our services available to a lot of people that otherwise wouldn't have access.
If they don't have insurance or Medicaid or some other way of paying for therapy, I think it's a really important ethic that DFI has, that we don't want those people having to go without mental health treatment. And so we have a fantastic group of students here where they have great training, great supervision, like I said before, and so they're really doing really good work, and at such a low cost. I think it's a huge benefit to the community.
Some of the waiting lists that my clients have told me about before they got into DFI are so long, And when families are experiencing issues, they need to be seen so quickly. And so DFI has incredibly accessible, affordable services that really impact the community in a great way.
The stories can make you cry if you think about all the people that tell us we've tried everywhere else, they can't get us in. We can't get an appointment. We can't afford therapy.
It's a tremendous resource, and something that we want to do more with in the community to be more available.
You don't have to qualify here. You don't have to, you just have to show up and say you want services, and we will provide services, and at a very low cost. It's a model that's really very, very difficult to duplicate.
It's part of our mission or part of our value to offer a service to our community, which is, it's really nice, it's comfortable, it's warm, it's familial. It's in contrast to a lot of the other centers that really have more of a clinical medical feel. We want you to feel at home here. We want you to feel safe. We want you to feel secure. And the clinic is set up in such a way to enable that.